Actuality, Reverend Freeman and I had a little discussion about trust, and we both agreed that that is an important ingredient of what we're talking about today, but also an important ingredient is a hug. And so we decided that's also something that we all need from time to time. The final panel this afternoon is an exploration of the role of health literacy in various types of palliative care programs, and this is moderated by Dr. Marian Grant. It's an important panel. It'll have a lot of perspectives. It's also important to me because one of the individuals on the panel, Dr. Dana Lustbader, and I have go back a little while in our medical experiences. We began thinking about what we're talking about today about 12, 13 years ago on the ICU, CCU at North Shore University Hospital. We began talking about something that later became palliative care. We talked about it as being communication and good care. But here we are today, Dana, so this is really a good follow-up. Dr. Grant is a nurse practitioner, duly certified in acute care and palliative care, hospice, and an assistant professor at the University of Maryland School of Nursing, where she teaches courses on communication, evidence-based practice, and end-of-life nursing. She is also on the University of Maryland Medical Center's palliative care service as a nurse practitioner. In 2014, Dr. Grant was named the Robert Wood Johnson Foundation Health Policy Fellow. She is also on the board of the National Hospice and Palliative Care Nurses Association, co-chair of the Public Engagement Work Group for the National Coalition to Transform Advanced Care, and blogs monthly, I don't know where you have all this time, for the Journal of Palliative Medicine. The focus of her work is and remains on several issues, including raising clinician and public awareness of palliative care and advocating for policy changes to make these services more widely available. Dr. Grant.
Thank you so much. Before I want to introduce the panel, I do want to say that we've talked about some difficult things, and we've talked about some opportunities, and I think some of the examples that are going to be given today, I like to think of as little candles out in the dark. And my hope is that these little pools of light will ultimately become beacons, and that we can, all of us, work together to bring this type of care more widely to the U.S. And I do want to acknowledge a very brave move on the part of our government yesterday, in that the CMS announced that they are going to at least propose billing codes that will allow providers to bill for our time for having advanced care planning conversations. For those of you who, for those of you who are traumatized in 2009, like the rest of us, with the whole death panel nonsense, I think this marks a brave new day. And I'm hoping that the fact that in the last 23 hours since the announcement was made that we have not heard about death panels is a sign that maybe those days are behind us, and that poor language is a part of health illiteracy that will go away forever. Let me introduce the panel. So our first speaker is Dr. Stacy Pinder-Hughes. She is the Director of Palliative Medicine at Boehner University Medical Center, Phoenix, and the Chair for the Division of Palliative Care for Banner Health. She is board certified in palliative medicine, geriatrics, and internal medicine, so sounds like a busy person. She is also a clinical associate professor of internal medicine at University of Arizona. Our next speaker is Dr. Dana Lustbader, who will be presenting on a home-based palliative care program. I think a very exciting development. She is clinical professor of critical care and palliative medicine at Hofstra North Shore LIJ School of Medicine. She is department chair of palliative medicine at Pro Health Care Associates, a large physician-run multi-specialty group and ACO serving the New York metropolitan area. She created and is the medical director of Pro Health Care Support, a home-based advanced illness program providing medical care to people with serious illness while supporting their family caregivers. What a concept. Third, we have Dr. Ann Kinderman presenting on palliative care in the hospital setting. She is an assistant clinical professor of medicine at the University of California, San Francisco, and is the director of the Supportive and Palliative Care Service at San Francisco General Hospital. Dr. Kinderman's scholarly work has included developing a curriculum in palliative care interpreting for professional medical interpreters. So that was a question in the last panel, and now we have an expert to talk about that. Also promoting high-quality care for vulnerable patients with serious illness and expanding palliative care services in safety net health systems. Our last speaker, and I credit Ms. Melissa French for putting the preacher at the end of the panel this time rather than the beginning, he will present on building palliative care relationships in the community. Reverend Pitts presently serves as the Ecumenical Officer and the General Secretary Emeritus of the Progressive National Baptist Convention, Incorporated. He is also the President and CEO of Bridges International, LLC, a consultant service with the mission of building reconciliation in international development and global education strategies among churches and civil society. Dr. Pitts is also a member of the staff team for the New Baptist Covenant, spearheaded by President Jimmy Carter.